Hello, I'm Dr. Dennis McKenna. As always, I'm joined by Dr. Fred Venditti, our hospital system general director, giving you the update from Albany Medical Center on the coronavirus. Today is Monday, May 4th. Fred, it's Monday. You look like you got some color this weekend.
Yeah, I was on my bike. I think got a little windburn.
Excellent.
Yeah.
So in the 5 local counties, we are reporting that there are 2,627 patients who have tested positive for COVID-19. We'll continue to update those numbers on a daily basis as we go forward. Inside here in the medical center, same number really as we had last week. We currently have 57 who are currently being treated for COVID-19. We have 37 on the floor. We have 20 in the ICU, and we currently have 6 on ventilators. It's important to point out that of the patients we're treating, we're currently only treating them on 5 different units. We have 3 med-surg units and 2 ICUs. So the rest of the hospital has no documented cases of COVID-19.
That's right, Dennis.
Remind us, how many units do we have in the hospital currently?
So we could have as many as 34 units. Right now we don't have them all open because our census is low.
But only 5 currently with confirmed
Only 5.
COVID-19.
Yep.
We thought, since this is approximately 50 plus days into this current reporting structure, that we would give you some high-level numbers on what we've experienced here in the medical center. So forgive me while I look down. We've admitted so far 233 people who have been positive for COVID-19. That includes people from the region as well as the transfers we took from New York City. Of those 233, 104 have ended up in an ICU, and of those, 66 have ended up on ventilators. So let's go back to the 233. That includes the 57 that are currently in the hospital. That means that 176 have either been discharged or died. Of those, 82%, or 144 of those, have actually been safely discharged to home. And then sadly, the 32 have died. So that's an overview of the numbers up to this date.
There's another number, though, that's important as well, Dennis. If you go back all the way to April 22nd, which is almost 2 weeks ago, we've hovered in terms of the total number of patients in-house with COVID between 53 and 57. In that range. Basically, we've been plateaued for 14 days.
Now, that's important because one of the things that you have to do over a 10-day period is not go up in cases. Is that correct?
That's right. If we're going to start to do elective surgeries, we want to make sure we have enough capacity for any surge, and obviously we're not having a surge. We're able to care for the patients coming.
Speaking of which, as we spoke about last week, the medical center is going through the process, and Fred will give us an update on our application for a waiver to begin doing what the state is calling elective procedures, what we continue to call medically necessary procedures. There was an article in the Times-Union actually this morning just on this particular topic, very balanced, very well written, that talked about why we believe it's an advocacy issue for this region for us to start doing these cases again. Fred, what's the update?
So Dennis, you're absolutely right. There are patients out there that need that medically necessary care. So on Friday evening at about 5:30, we filed a waiver with the Department of Health, basically detailing how we think we can safely not only start elective surgeries, but continue to care for the COVID patients that are coming at us, and even a surge if that were to happen. So that application actually was reviewed in a very timely manner. Actually, I got an email 11 o'clock last night from the department asking for some more information, but the tone of the email was very favorable. So we're going to submit that information. We intend to do these elective cases at our South Clinical Campus on Hackett. So that campus has kind of been closed. It's out of the mainstream, and it will be a COVID-free facility where we'll be able to provide those cases. It'll be short cases, ambulatory cases, cases that rarely require blood or hospitalization. So it really won't affect our ability to provide care on this campus, and also cases that don't use a lot of PPE. So we think we're going to meet all the criteria when we answer the questions the department asked us in the email last night.
Okay. So obviously this is something that today's Monday we'll talk about each day this week. This is an incredibly important topic, and we'll continue to update that. The other thing we're going to talk about all week is the fact that it's Nurses Week here, and we're going to use each day this week to talk about our incredible workforce and our incredible nurses. When people think about nurses, they often think, rightfully so, about nurses providing care at the bedside. And obviously, we know that our nurses are the very best. In point of fact, we're wearing shirts today representing the Children's Hospital, where I think we are very proud to say that we have nurses who provide care that really no other hospitals do.
That's right, Dennis. Our Children's Hospital is unique in the region. We provide care for over 600,000 children in a very large area. We have specialized nurses in neonatal care, in critical care, in emergency care, in outpatient, standard wards. And I'm happy to say that one of those very fine nurses in our Children's Hospital happens to be my sister, Mijo.
Excellent. So we'll use this week to highlight nursing. Nursing at the bedside. Nursing also does case management and social work. They help build our electronic medical record. They're involved in quality. They're involved in education. They serve so many roles, inpatient, outpatient practice. We're going to highlight a lot of those this week. There's even some awards that are going to be given out to some of our nurses this week. We'd like to highlight those as well. But let's take a moment. Let's hear a video right now from Nursing Leadership that's going to talk about our incredible workforce.
National Nurses Week is celebrated the first week of May. These are challenging times for all of our nurses. This year, with COVID-19, our nurses have stepped up to the plate. Our nurses continue to innovate, they continue to excel, they continue to lead. Our nurses are nurse recognition is more important than ever before. This year, during Nursing Recognition Week, we celebrate the Year of the Nurse, and we celebrate Florence Nightingale's 200th birthday. To quote Florence Nightingale, "Nursing is the gentle art of caring." Thank you to our nurses who continue to work tirelessly to care for our patients. Thank you for all you do.
Thank you, Diane, for that tremendous message. The nurses at Albany Medical Center are just fantastic.
Yes. And I would agree, and I'll throw out a hello to my wife, who's also a nurse here, who also does a wonderful job. That's it for today. It's Monday, so we're going to celebrate nurses all week. In addition to that, we hope to have some more information on the restarting of the medically necessary cases here at the Medical Center. We hope you all had a great weekend. We'll be back again tomorrow. We ask that you please take care of yourself, take care of each other, and we'll see you tomorrow.